At Briar Veterinary Hospital, it's a 2-doctor practice. It's a general practice, so we see mostly dogs and cats, but we also see exotics because Dr. Vicio has an interest in exotic animals, and she's also got experience with it, so we can see birds, lizards, snakes, hedgehogs, rabbits, anything that's not a dog and a cat. The building itself was once a house in the 1980s before the old owner, Dr. McMasters, converted it into a veterinary facility. The house has the waiting room, a reception desk, 3 exam rooms, a treatment area with dentistry, radiology, and dentistry equipment in a surgical suite. Also, we have a kitchen for staff and also where we run surgical equipment through autoclaves. We have a section for radiology, for x-rays. We have storage. The upstairs is mostly for office spaces. We have extra caging in the back along with more storage. And there's also a staff lounge where we can relax and eat lunch. And procedures performed at Briar Patch consist of spays, neuters, dentistries mostly. But because of Dr. Vicio has gone to numerous conferences and schooling, she has a high interest in specialty in surgery, so they are expecting to get more complicated surgeries. Like last week on the 25th of June, she had performed a leg amputation, which was quite exciting to be a part of. So Briar Patch is a general practice, but we do get to see exotics along with the cats and the dogs. Briar has also accomplished AHA or AAHA accreditation, the standard of veterinary excellency. They maintain the high standards in the veterinary field and improve patient care and quality through being thorough, responsive, sanitary, and safe, and a place where everybody wants to bring their loved pets and know that they're going to get the best vet care possible. So these are pictures of the back of the clinic. And the first picture is extra caging that we have for patients who may be waiting for their owners to come pick them back up, or where they go back to relax because they're really stressed out before or after any procedures are done. And the second picture is where we store all the dry food and wet canned food for the clients, and where we keep extra for when the doctors prescribe it to the owners for their pets. And the third picture is the kitchen area where the staff has 2 refrigerators for their lunches, the autoclave is there, a dishwasher, and all the extra storage for the cleaning supplies and extra food like peanut butter and cheese that we use with the animals to make them more comfortable. And this first picture, this is a part of the treatment area, and along these walls are doors that lead into the exam rooms that the techs and the doctors use to go in between the treatment area and the exam room. Also along this wall we have pamphlets for client education on products that the clinic carries, such as Feel-Away. The Feel-Away is used to calm the felines because the spray is meant to smell like the hormone that the mother releases when the kittens nurse, so it's meant to help calm the cats and let them relax, which is kind of difficult for some of the felines that we see. But we're a friendly feline practice, so that's why we carry it. Also, there are stethoscopes for the doctors to have easy access to clean stethoscopes for each appointment and ready to go at a convenient spot. And next to the stethoscopes are the muzzles, They're arranged by size, so in case of an emergency or if we need to protect ourselves from being bit by a dog, they're at an easy, quick, accessible location where everybody knows where they are, and we can quickly grab a size without having to dig through a big pile of them. The whiteboard in this picture is where the appointment sheets are hung, so everybody knows when each appointment comes and what the client has come in for. Once we see it, we go into the exam room and we can start the appointment for the doctor, and that's when we get the history and why they're there mostly, so the doctor has an idea of why the patient has come in. An exam room has a scale in it for each cat or a small dog, but the large scale is located on the outside, as you may be able to see in the picture. So it's quick and easy and a stress-free wait for each patient. So we can just leave the exam room quickly, go get a weight, and go right back into the exam room without meeting anybody else or altercating between patients in the treatment area. And the second picture is where our main computer is, that we access the medical files, lab results, and vaccine reminders. And we also use this computer for other things such as Slack, which is the communication board that we use in the clinic for reminders and PR calls and just communication with the doctors. The fridge is where the vaccines, medication, and any lab work that's being sent out to the lab is put. So when IDEX comes, which is the lab that we use, we can just run back, grab it, and go give it to the FedEx man. Next to the computer is where the test tubes are, the needles, syringes, the wing infusion sets, and the microtainer tubes. So everybody can go and quickly grab what they need as quickly as possible to keep the animal as calm and relaxed as possible and still get our jobs done. The table to the right is where the majority of the treatments are performed, such as like ear cleaning, toenail trims, vaccines, cystocentesis, blood collection, anal glands, and subcu fluids. And when we're doing surgeries on like Tuesdays and Thursdays, we clip the surgical site and place catheters on the table as well. And then the third photo is a table where we perform dentals. It's kind of hard to see in this picture because of the angle I took it at. I'm sorry about that. But this is where we can do dentals, but we also can take radiographs for the dentals for the doctors to be able to identify what teeth are healthy and what teeth need to be removed. And behind this table is where we do the in-house lab work. We have machines like the urinalysis machine, the 4DX analyzer, a catalyst machine, and a chemistry machine. And unless we have to know the results right then and there, we mostly just send the blood work, fecals, right out to IDEX, and we were given the results within a few days. So in the first picture is the waiting room. We have coffee, we have comfortable chairs, and we also have towels in a bin for clients with cats that have been sprayed with feel away to help calm their cats while they're waiting. The owner of the practice, Dr. Reinhardt, her goal is to make sure that nobody waits longer than 10 minutes, because everybody dreads going to the vet due to the wait, and they think that they're going to be there forever. So we want to give them a great experience and make them not have to wait long, and make them feel more important as we see them quicker. So in the second picture is exam room 1. We most commonly use this room for felines. We have a baby weight, an exam table, chairs, and a sink in each room. This room is used for felines due to the size. Most dogs don't fit in this room comfortably because it's a smaller room. And the third picture is exam room 3, which is our biggest room. This is where we put more of our large breed dogs, well, most of our canines, because the other exam room is reserved for exotics. But in this room we do laser treatment and also acupuncture. And we also have diagrams and models of anatomy parts like the mouth or the knee, so Dr. Reinhardt or Dr. Vicio can show and give the client some education on what may be going on. So they can also use this room for surgical explanations. And I don't have a picture of exam room 2, unfortunately, because there was a client when I had the opportunity to take pictures. But exam room 2 is similar to exam room 1, except we have controlled lighting. So for reptiles and birds, if we want to make it more dim, but we still want to be able to see the animal, we have the ability to control the setting of the lights. And we also have special scales and equipment in there, so we can have everything right then and there when we're dealing with a reptile that doesn't want to be held anymore, or a bird. So we mostly see the exotics in room 2 due to where the equipment is and the lighting. And it's also a more comfortable room for the exotics because it's not nearly as cold as exam room 1 or 3. Dr. Reinhardt. Dr. Reinhardt is the owner of Briar Patch. She has been the owner since 2016, once the old practice owner, Dr. McMaster's, retired and sold the practice to her. She graduated from Cornell University in 2011, and also in 2011, she was certified in veterinary acupuncture from the Chi Institute. Dr. Reinhardt definitely enjoyed challenging me and having me try new things and new techniques. She had me take my own appointments and tell her the histories of each patient, and she even had me be in charge of the front desk for a day, well, with some help. Also, she made sure that I learned something new every day, whether it was information about medication or how to run a different lab test or look at a lab sample, or a different technique like a different way how to restrain a cat, the cat-friendly method, so less is better. But she definitely made sure I had a great place to learn from, and I had a great time learning during my preceptorship. Dr. Catherine Vicio, or Dr. Vicio, graduated from Cornell University in 2015. She's the other doctor in the practice along with Dr. Reinhardt. She is the exotics doctor, but she also does surgery and small animal medicine, which is mostly what she practices. So throughout my preceptorship, Dr. Vicio taught me how to restrain and work with exotics, like birds, snakes, and hedgehogs. With birds, when you cut their feathers, their beaks, or their nails, it's really important that you hold them properly. And she took her time and showed me how to do it when we had time, and she let me help with appointments. She also allowed me to scrub into my first surgery, and she allowed me to assist in the leg amputation. Also, if I ever had a question on the treatment or prognosis or diagnosis, and I asked her about it, she would gladly sit down and explain the medications, how to treat it, and what the diagnosis actually meant for the animal. Ann Garrison is the practice manager. She's responsible for all the non-medical needs of the hospital, so she's keeping the hospital running clean and smooth. She's responsible for client communication, mostly keeping the clinic running smooth when we are really busy, and she hires new employees. And taught me how to run the reception area by showing me how to check people in and out, charging people, scheduling, and taking phone calls. Usually Ann is not on the front desk, but because we do not have a reception at the moment, a receptionist, she's stepped up and she's helping where she can help. And she likes to be with the people, with the clients, and she can help them as well, best as she can. And she also she does the seeing eye dogs, and she raises the dogs when they're 6 months to a year, and then she trains them, and then they go on to their next family. And she's also taught me about that program, and I actually might get into that program because it's a fantastic program for kids in needs and a way to show my love through animals and helping people. BJ is a licensed veterinary technician, and she's also the team leader at Briar Patch. She graduated from Camden Community College in 1989 and has been a practicing LVT since then. She's responsible for keeping the back of the clinic running smoothly and responsible for inventory and the clinic communication. And she's also a fantastic mentor. BJ showed me more than I ever thought that I would have learned during my internship at Briar Patch. But not only did she show me, but she also had me perform the tests as well, such as monitoring anesthesia, radiographs, blood collection, taking appointments, and learning how to have client communication and education. She has been a great inspiration and mentor as I'm learning about what it is to be a LVT, and I can't be more excited. I can only hope to be half of the tech as BJ is. Carissa is the other licensed veterinary technician at Briar Patch. She graduated from Alfred State College in 2010, and she's been an LVT since. Carissa takes appointments, she does dentistry, radiology, lab work, front desk, and she's also a surgery tech. Like everybody else, Carissa was more than welcoming and excited to have me at Briar Patch, and she showed me how to run lab work in-house, set up the anesthetic machine. She showed me how to operate the medical file system, actually both of them. and she encouraged me to try new things even if I was unsure. But with her help and guidance, I'm now confident with my ability to draw blood and answering the phones. Tammy is a veterinary technician in training. She's technically a tech assistant currently until she finishes her online courses for veterinary technician. At Briar Patch, Tammy takes appointments, gives vaccines, restrains, runs lab works, and works on the front desk and helps with the difficult clients. Since Tammy and I are both still learning, we help each other out as much as we can. She's taught me how to wrap surgical packs, how to talk to difficult clients and keep them calm, and how to operate Slack, which is the online system we use to communicate with each other throughout the day and the week. Ruby is my first case study. She's a canine Rottweiler who is 6 years old. She weighs 34.5 kgs or 76 pounds, and she is a female spayed. Ruby was presented to the vet in late April, early May with a mass located approximately on the region of the tibia. The owner had reported Ruby was less active and she was limping, avoiding bearing weight on her left hind leg. When Dr. Visio took a cytology of the mass and observed it under the microscope, she had determined that it was osteosarcoma, and the prognosis was not good for Ruby. Once the mass was discovered to be an osteosarcoma, her owner was given two options. The first option was to euthanize Ruby before the cancer spread too far and caused her too much pain. And the second option was surgery to amputate the left hind leg before the cancer spread any farther through her bones, and to give her a chance at a healthy life. She would just have 3 legs instead of 4. Her owner decided that she was too young to just euthanize and she was healthy and happy, so she elected to have the surgery performed to give her a better quality of life. On the day of the surgery, Dr. Visio decided to give Ruby a full physical to make sure that she was a good candidate for the surgery before starting. So her temperature was 101.7 degrees Fahrenheit, her pulse was 84 beats per minute, her respiration was around 18, her mucous membranes was pink and moist, she was bright, alert, and responsive, and her capillary refill time was less than 2 seconds. Once Dr. Visio determined Ruby to be fit for surgery, we got a pre-anesthetic of midazolam to help relax and sedate Ruby. When she became relaxed and tired, we took her out and placed the catheter and started to clip the surgical area. Once clipped, the prepared surgical site was wiped with chlorhexidine and alcohol. Once we moved Ruby into the surgical suite, we induced anesthesia by using propofol. Ruby's surgery took approximately 3 hours to complete. Throughout the surgery, Ruby maintained a stable plan of anesthesia for the entire surgery and did not have any complications. Each vein and artery and even nerves were carefully ligated and cut by Dr. Visio. Each nerve was injected with lidocaine to block the nerve prior to being cut. The surgery was a huge success and the leg was removed with no complications. Ruby was fantastic through all of the surgery, all of 3 hours. She was very stable through it, and we gave her an IV drip of pain meds to help make her more comfortable as she was waking up. Dr. Vicio prescribed amoxiclav to prevent the infection of any of her incision site, carprofen at 75 milligrams for 2 times a day to help control the inflammation and prevent any pain that may be caused from the inflammation. The tramadol 50 milligrams for 3 times a day for pain relief, and the gabapentin 300 milliliters 2 times a day for nerve pain and to help with Ruby staying calm and relaxed and just not in pain. This is Cooper, my second case study. He is a canine Redbrook Welsh Corgi who was born in March 4th, 2007. That makes him 11 years old. He weighed 13 kilograms. He was 28.7 pounds. And he's a male. Dr. Vicio prescribed amoxiclav to help with the infection in Cooper's lungs. He also received anaphylaxis, which was meant to treat the bacterial infection that he also had in his lungs. After the treatment, Cooper came back on June 18th for a recheck, and the radiographs were clear and the bronchoammonia was treated. His mucous membrane color improved from a pale pink to a pink, and he was bright, alert, and responsive instead of lethargic. And his appetite returned, and he no longer was coughing. So here is my third case study. This is Linus. He's a 2-year-old male hooded rat who was presented with a mass on the right side lower jaw or mandible. I unfortunately did not get consent to use his picture, so this is a picture I found online. Anyways, according to his owner, Linus was still eating and drinking well, but she was concerned about the mass since she left home and was on vacation, and somebody was watching him, and once she came home 3 days later, he had what appeared to be a mass on his lower jaw, but it was not restricting his ability to eat or drink. So Dr. Vicio decided that she would need a cytology of the mass in order to determine if it was malignant. And to our surprise, when we went to go get the sample, the needle and syringe, instead of filling up with air and cells, filled up with pus. Once we discovered that Linus did not have a mass on his face but a facial abscess on his lower right mandible, the owner elected to have the abscess drained. So using techniques I learned in rats class, I used a backpack restraint while Dr. Vicio used a lance to open and drain the abscess on the mandible. After the abscess was drained, Dr. Vicio left the skin open in order to kill the anaerobic bacteria that was in the abscess causing the pus. With further exploring, Dr. Vicio believes that the abscess was caused from a bad tooth, so the owner has elected to get x-rays and a possible dental if there's a bad tooth that needs to be removed. But I don't have any radiographs since he has not come back in for his radiographs yet. After the abscess was drained, Linus was sent home with SMZ-TMP suspension in order to treat the bacterial infection, and he was also sent home with meloxicam to control or to help with the inflammation on his mandible where the abscess was. While at Briar Patch, I was considered the intern or a tech in training, or that's how we described me to the clients. And once they taught me how to take histories and run appointments, I started taking my own appointments. But before then, I was giving injections, learning how to run lab work. I drew blood from the cephalic, the jugular, and the saphenous. I cleaned ears and also treated them when they had bad yeast infections or bacterial infections. I cut toenails on cats and dogs and even birds. And I also helped with wing trimming and beak trimming. I learned how to dispense medications, both controlled and not controlled. I restrained birds, cats, dogs, rabbits, rats. I performed anal glands, or I drained the anal glands, radiology with help. I monitored anesthesia. I gave the IM sedative for the pre-anesthesia. I placed the IV catheter on my first try, which I was very, very proud of myself. I wrapped surgical packs, cleaned a lot, did laundry. I learned how to make appointments, make phone calls, do PRs, which are callbacks after appointments. And I learned or observed how to do dentistries. And I also learned the care that you do monitoring the patient after anesthesia. I got to use the laser therapy on a dog that came in every week, so I actually got the opportunity to run the laser machine and help with the acupuncture appointment. So I worked both up front and in the back, so I learned reception and I also learned the back, but I also got to learn how to have communication with the clients and how to educate them with the different flea medications, heartworm preventions, and I even helped an owner with selecting a better food for their animal with the help of Dr. Vicio and Dr. Reinhardt. Also, I got to assist in surgery. I got to scrub in and hold the leg during the leg amputation for Ruby during the 3-hour surgery. So I actually got the opportunity to be a part of a surgery other than observing or monitoring anesthesia, which I enjoyed I enjoyed it so much. When I went to go interview at Briar Veterinary Hospital, I took in that it was a very calm, peaceful place. It was very clean and it was running very efficiently when I was waiting for my interview. So once I got the opportunity to do a preceptorship there, I was beyond ecstatic to have the opportunity to learn and be at a very pristine clinic. So during my time at Briar Patch Veterinary Hospital, I had one of the best experiences I could ever ask for working in a vet clinic. I was nervous at the start of my preceptorship since I would be helping with the everyday things that we learned in school, but now I had to apply it to a client who brought in their beloved pet. Everyone was more than willing to help me with the opportunities to learn and try new skills, as well as teaching me what they know from their experience for being in the field from anywhere from 6 to 25 years in clinic. So going into the preceptorship, from being in practice at the school with the small and animals versus the large animals, I always thought that I would be with large animals, but after my experience at Briar Patch, I am not considering working with small or mixed practice once I graduate and become a licensed tech. Also, with the experience I learned with the exotics from Briar Patch, it could help me later on if I continue to work at Briar Patch or at another clinic that sees exotics, considering I already have some experience with handling exotics. If I have the opportunity after graduation, I would love to return to Briar Patch and work full-time. That would be a major accomplishment since they're a fantastic team to work with and to learn from. I am also proud to say that I have been offered a part-time job to continue my work at Briar Patch, which I gladly accepted and am excited to start and continue to learn